On how Hirschsprung's disease, which is also known as congenital aganglionic megacolon. This is a developmental disorder that occurs when there is an absence of ganglionic cells in the distal colon or rectum. These ganglionic cells are essential for normal bowel function as they control the movement of the intestines through peristalsis, which is the rhythmic contraction that propels food through the digestive tract. Without these ganglionic cells, the affected part of the bowel cannot properly move or propel waste, leading to a functional obstruction in the bowel. This condition can cause significant discomfort and difficulty with bowel movement after birth. Now let's dive into the pathophysiology of Hirschsprung's disease. During embryonic development, neural crest cells are supposed to migrate and populate in the intestinal wall. In Hirschsprung's disease, this migration fails to occur in affected segment of the colon or rectum. As a result, there is a lack of ganglionic cells in that area, which are crucial for normal function of the bowel. Without these ganglionic cells, the bowel loses its ability to carry out peristalsis or the normal contractions that move food through the digestive tract. This impairment leads to a functional obstruction, meaning the affected bowel segment can't properly relax or contract. As a result, the proximal bowel, the part before the affected segment, becomes dilated as it tries to push contents past the obstruction. Let's talk about how 3D and 4D ultrasound are used to assess diagnosing Hirschsprung's disease. 3D ultrasound is not typically the primary method for diagnosing this condition, but it can be helpful in providing a detailed view of the dilated bowel loops. It allows us to assess their spatial relationship and how they interact with other abdominal structures, giving us important information for diagnosis. 4D ultrasound, which provides real-time imaging, is particularly valuable in evaluating the peristalsis of the bowel. In cases of Hirschsprung's disease, we may see absent peristalsis in the affected segment, which helps us distinguish this condition from other causes of fetal bowel obstruction. Real-time visualization of the bowel's movement or lack thereof can be a key diagnostic tool. Now let's review some of the key findings of Hirschsprung's disease on ultrasound. The most notable feature is dilated bowel loops. These are fluid-filled loops of bowel that are proximal, which means before the aganglionic segment. These dilated loops result from the inability of the affected segment to propel contents forward. Another common finding is echogenic bowel. The affected bowel may appear hyper-echogenic, which means brighter in the reflectivity of the ultrasound waves, due to the presence of undigested materials or changes in bowel mobility. In more severe cases, amniotic fluid anomalies can be observed, such as polyhydramnios. This is an excess of amniotic fluid, which may be caused by impaired swallowing or decreased gastrointestinal mobility. It's most probably late onset polyhydramnios. Finally, absence of peristalsis is a key diagnostic sign. With real-time imaging using 4D ultrasound, we may see the absence of normal peristalsis in the aganglionic segment, which helps differentiate Hirschsprung's disease from other bowel conditions. Hirschsprung's disease can occur in isolation, meaning it's the only anomaly present. However, it's also seen as part of syndromic conditions, genetic syndromes, where multiple abnormalities occur together. Some of the conditions associated with Hirschsprung's disease include Down syndrome, which is a genetic disorder caused by an extra chromosome 21, Waardenburg syndrome, a condition that can cause hearing loss, changes in skin pigmentation, and other features, multiple endocrine neoplasia type 2, a genetic condition that leads to tumors in endocrine glands. Recognizing these associated conditions can be essential in managing Hirschsprung disease, as it may affect the overall treatment plan and prognosis. When Hirschsprung's disease is suspected prenatally, it is important to monitor the fetus carefully, and postnatal confirmation is typically made with a rectal biopsy, which identifies the absence of ganglionic cells. The primary treatment is surgical correction, which involves resecting the aganglionic segment and then reanastomosing the healthy bowel to restore normal function. The prognosis is generally good if surgical intervention occurs in a timely manner. However, complications can arise, including enterocolitis, a severe inflammation of the intestines, and long-term bowel dysfunction, which may require ongoing care. With appropriate treatment and management, most infants can lead normal lives, but follow-up is crucial to monitor for any post-surgical issues. Let's